Welcome, everyone. My name is Ian Colbert. I am the Executive Director of the Canadian Public Health Association, and I am pleased to be co-hosting today's webinar and want to acknowledge that while we're joining today from all parts of Turtle Island, CPHA's offices and my home are located on the ancestral unceded territory of the Algonquin and Anishinaabe. This is the second of our 4 webinars to be offered for our Net Zero project that was funded by the McConnell Foundation. This project is being conducted collaboratively by CPHA, along with the Canadian Health Association for Sustainability and Equity and the Ontario Public Health Association. And I'm now going to pass over to Kim Parada, the Executive Director of Chase, who will be facilitating today's session. Kim, the floor is yours.
Thanks, Ian. I'm calling in today from the city of Hamilton that is situated on the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. With the Net Zero project, we've been examining strategies being used by public health agencies to advance interventions that can improve health and reduce health inequities while also reducing climate emissions. Today, we have 2 speakers. Birgit Isenhagen is the Environmental Health Policy Lead with Ottawa Public Health. She's co-located with the Planning Department at the City of Ottawa. She has a master's degree in science, an environmental professional designation, and 20 years of experience working on healthy built environments, urban planning, and climate change. Ilse Serde is the manager of recycling and waste management with Cowichan Valley Regional District in BC. During her 10-year career at the CVRD, Ilse has worked on a wide variety of issues, including the connection between residential home heating, air quality, and health. She's currently focused on waste reduction. We'd ask you to post your questions on the Q&A module. If you want to introduce yourself and let us know from where you're joining, feel free to do so in the chat box. We'll be posting the presentation on the CPHA YouTube channel, and everyone who's registered for the webinar will be notified when the recording's available. And we would appreciate if you take a few minutes at the end to complete the evaluation survey after today's webinar, because that helps us to know how we might make improvements for the future. And just to note that we will be holding questions for both presentations until the end. Thanks very much. Over to Ilse.
Thank you very much, Ian and Bridget. Sorry, Kim. So as Kim mentioned, my name is Ilse Serde, and I'm the manager of waste and recycling for the Cowichan Valley Regional District, which we call the CVRD for short. So my division primarily works on waste reduction and recycling, but we have also been helping to offer this rebate program to improve health by overcoming the barriers for people to invest in healthier home heating. Also, we want to shout out to Ian here for helping me with the presentation and offering next slide, please. So for those who have not been to the Cowichan Valley to enjoy our many fine wineries, excellent mountain biking, and cute communities, we are located on the west coast of Canada on Vancouver Island. Cowichan gets its name from the Quotsum, which is the original inhabitants' name for the valley. And it is rooted in the Halkominum language. And if directly translated, it means to warm one's back in the sun. And this is why the Cowichan Valley has always been known as the warm land. Next slide, please. So to our topic of today, which is wood smoke and health. So the Cowichan Valley is a semi-rural region, and heating with wood stoves has been very common, and unfortunately still is very common. And as you can see on this slide to the right, in the wintertime, we often experience a smoky haze from backyard burning and wood stove use. I have a few little things on this slide, so Ian, if you want to click next, you will see them pop up, hopefully. Yeah, thank you. There's one more. Awesome. So back in 2012, when we made this a little campaign poster of the kid with a puffer, we decided to work with Island Health and the province to come up with a way to raise awareness about health impacts of wood smoke. At the time in 2012, the rate of children ended up in hospitals with asthma was 70% higher than the BC average. So yeah, we joined this program in 2009. And since the program started, it was called the Wood Stove Exchange Program, and now we've changed it to the Wood Smoke Reduction Program to sort of more communicate what this program is about. So in addition to the province, this program was created with the help of the BC Lung Foundation. And as I mentioned, it's working to increase public awareness as well as provide rebates to help residents overcome financial barriers of healthier home heating. Next slide, please. So to our surprise, when we in 2014 did a phone survey to ask residents what kind of home heating they use, we learned that there's still a lot of wood stoves out there, and some of them are very old, 20 to 30 years old. What's problematic with that is that these wood stoves are not very efficient. They use about 1/3 more wood to create the same amount of heat as a modern wood stove, and they produce a lot more smoke than a new EPA certified stove. The other issue with wood stove is that there is an inherent risk that wood stove users won't use them correctly. Some people use wood that is not properly dried or dampen down their wood stove, which is choking down the oxygen. So it also creates a lot more smoke. So our long-term goal is to move people to only using wood stoves in the case of emergency as backup use. Next slide, please. So here's a little bit of like, why is this so important in the Cowichan Valley in particular? So the Cowichan Valley is a valley, and we're surrounded by mountains, which is a little bit like living in a bowl, which you see this little owl in a bowl. Next slide, please. Because of our unique weather and topography here, we also experience a lot of weather inversions, which means that warm air ends up trapping cold air to the ground. So you see it illustrated in this image is like air pollutants, like from backyard burning and wood stoves, ends up staying here for many days sometimes, which is really impacting people's health. Next slide, please. Oh yeah, so you can compare it to putting a lid on the bowl when you have these weather inversions. Next. Okay, this is interesting. So one of the main issues with, sorry, I don't recognize the slide, which is why I'm a little confused. So many residents have an issue with using upgrading to a new modern stove because of the cost. And they also feel like they are very vulnerable to power outages here in our rural valley. So one of the main barriers that we heard from residents, like, that's great that you offer clean heating options like gas and heat pumps, but I live further out, and I'm very vulnerable to power outages. So they're reluctant to upgrade. Next slide. And next slide. Great, we are on track. So as per 2023 air quality study for the region, we have seen a downward trend in the number of days that we have exceedances of the provincial levels of PM 2.5, which is great news. But what we also have seen, and what many of you are experiencing right now, is that not only in the winter, but now also in the summer, we have frequent air quality issues because of wildfires. So as part of our Airshed Roundtable that we have created, which represents the province, health professionals, and a bunch of other stakeholders, we have talked a lot about that it's become extra important that we do what we can to improve air quality in the winter as well as summer to help keep our communities safe. Next slide, please. So this data comes from fabulous regional medical health officer, Dr. Shannon Waters, and it demonstrates the rate of hospitalization rates for respiratory diseases per 1,000 children aged 0 to 14. And it's showing the years 2001 to 2018. So the pink line here that is higher is the Cowichan Valley, and the dark blue line is Vancouver Island as a whole, and then the teal line furthest below there is the BC. So again, like you can see that we experience more issues with respiratory diseases than the island and BC as a whole. But as you can also see, the line is dropping, so things are improving, thankfully. Next slide, please. Next. So this slide just shows a little bit of our rebates that we've been offering to help people invest in cleaner home heating. These numbers are based on the amount of money that we received from the province to create these rebates, and that amount differs every year. So originally, when we started this program in 2009, we only offered wood to wood. So you can only upgrade an old wood stove to a new EPA certified stove. But over time, we sort of discussed that this doesn't really make sense. We want to include other options for residents. So we experimented a little bit in 2017 to include gas as well as heat pumps. To our surprise, we saw that gas was very, very popular. But as you all know too, gas undermines our climate goals. So we decided to remove gas stoves from the incentives and really just try to focus on helping people upgrade to heat pumps, and for those who can't make that step, to upgrade to new wood stoves. So key thing to point out here, though, is that we have discovered that the rebate for heat pumps has been very piddly. So originally we offered $350, which is really not very much. And now we're up in $2,350. Ian, there's going to be some little arrows that you can just skip forward on this slide. So this is just showing top there, the rebates from 2009 to 2017 when we did wood to wood. And then as highlighted here, the rebates dropped significantly in the light of COVID. And we actually haven't recovered from that yet. So it'll be interesting to see what it will end up being this year and maybe next year. Thank you, Ian. Next slide. Another thing that we have noted traditionally is that most residents are interested in rebates in the colder months. So typically that is, you know, fall comes, you start thinking how I'm going to heat my home in the winter. I don't really enjoy my current heating system, but we do see, or we're thinking at least, that this might change as we're focusing more and more on heat pumps, and people might in the springtime become more concerned about how am I going to stay cool for the summer months and spring and summer. Next slide, please. So this slide gives you a little overview of where we are at with the rebates. So in 2022, we offer $350 for resident to upgrade from an old wood stove, so non-certified wood stove, to a 2020 EPA certified stove. And I understand that's the highest standard right now for wood stoves. So yeah, we've gone from 350 to 550. And the ministry pays $500 of that. And then we asked any participating retailer to offer a $50 discount. Then we also have wood to pellet stoves. So pellets are much cleaner than traditional wood stoves. And we've gone from $800 to $1,050 from 2022 to 2023. The ministry offer, again, the greatest amount here, which is $1,000, and the retailers offer $50. And then to my favorite here is heat pumps. So we have increased the incentive from $2,000 to $2,350. The ministry offers $1,500, and we offer $1,350. And then the retailers offer $150. And the reason why we as a CVRD pay out of our own pocket here is that we see that in the Cowichan Valley, the average income is not very high. So we're trying to do what we can to help people invest in heat pumps, but I'll talk more about that soon. What's new too is that the ministry introduced a bounty program. So if anyone has an old wood stove that they just want to get rid of, they will get $300. Next slide, please. So I think it's really important to talk about barriers. So as I mentioned there, when I was a little confused and flustered and I didn't see that original slide, is a big barrier. What we heard from resident is like, I don't want to remove my wood stove, which was a condition in the past. Like if you want to invest in a heat pump, you have to remove your wood stove. And the reason for that was because we wanted to have a guarantee that air quality was in fact going to improve. But now, because of the vulnerability aspect, especially in the winter when there are more frequent and intense winter storms, we don't want to leave our residents being vulnerable. So now they sign a pledge instead, where they pledge to only use their wood stoves in emergencies, such as power outages. And then we also have been experimenting. Again, we're only offering around $2,000, but many heat pump system costs way more than that, from a mini split system, $6,000, to a fully ducted system, maybe $16,000. So it's really a drop in a bucket, and it's asking people to front a lot of this money themselves. So we said, if you apply for a provincial rebate program or a federal rebate program, you can couple this rebate with any of those to allow you to get up to $6,000. However, I don't, to be honest, think that that's working so well. And a big problem for that is a lot of the application process for the provincial and federal programs are very complicated. What we're also hearing, for example, I talked to an older lady on the fixed income. She wanted to upgrade her home heating system, but we don't have that kind of money lying around. So are there ways to help residents with the upfront cost? Another thing we have discovered is, especially in First Nations communities, is the homeowner model is very different. So a lot of residents don't own their own home, so there's very little incentive to invest in it. So that's another barrier that we need to figure out and overcome. A lot of this program also been focusing on awareness, but as you also probably know, is that awareness is really not the key issue here. The main barrier is financial costs, and how do we help people access healthier home heating systems. Next slide, please. I have to say, though, one of the great benefits of this rebate program has really been working with our public health team. On this slide here, you see Dr. Shannon Water, who has, together with Cindy Lees from the Island Health Network and many others, Jay Jahida from the Built Environment, have been very generous and sharing their knowledge and sitting on our Airshed Roundtable team and working with them to both leverage knowledge and figure out how we can tweak this program to become more successful and helping people to ultimately improve their health. On this slide too, we have Earl Plain, a provincial meteorologist, and together they were featured in a movie or a little information video we created, which is Healthier Home Heating. I'm happy to share that with anyone. So yeah, from a resident's perspective, the benefit of this program has been that the application is really easy. It's really easy to participate in this program compared to any of the other incentive programs for healthier home heating. And as I mentioned, having the knowledge from many different stakeholders, including people like yourself from the health team network. So that was just a really quick overview. Next slide, please, of what we're doing here in the Cowichan Valley. And if anyone has any questions later on or would like to reach out and talk more about this, I'm happy to answer any questions now or later. Thank you so much.
Thanks very much, Ilse. That was great. And right now we're going to see Birgit getting her presentation up. But Ilse, that I don't know if you can still speak, but can you just say that have the heat dome that you guys experienced in BC, has that affected the interest in heat pumps from your residents or from your community?
It's definitely something that we hear when people are calling, inquiring about the rebate. That is something that they're thinking about for sure. Whether or not that has increased, actually it has increased in the recent months. We've seen that we've issued more heat pump rebates than before. So yeah, I think that's top of mind. Something else to add is the understanding that some heat pumps can also help to improve air quality, indoor air quality. So that's also something that people are thinking about.
Thanks very much, Ilse. That was wonderful. Thanks. Over to Birgit.
Hi, everybody. Thanks so much, Kim, for inviting me, and thank you all for attending. It's so wonderful that you're here, and I appreciate you giving up your lunch hour. My name is Birgit Isenhagen. I work for Ottawa Public Health, but I am co-located also in the planning department of the City of Ottawa, and I work in the Healthy Environment section for Ottawa Public Health. Trying to advance my slide. Hold on, there we go. So I would like to begin with a land recognition. I am joining you from the City of Ottawa. Ottawa is located on unceded territory of the Anishinaabe-Algonquin Nation. The people of the Anishinaabe-Algonquin Nation have lived on this territory for millennia. Today, Ottawa is home to approximately 40,000 First Nations, Inuit, and Métis people. Ottawa's Indigenous community is diverse, representing many nations, languages, and customs. The City of Ottawa honors the land of the First Peoples, as well as all First Nations, Inuit, and Métis in Ottawa, and their valuable past and present contributions to this land. To help situate everybody, Ottawa is located in Ontario and borders Quebec. It's physically the largest municipality in North America, and of course, it's Canada's capital. With an area of 2,800 square kilometers in size, you can see how we compare with the size of some other Canadian cities. So basically, the areas of Calgary, Edmonton, Toronto, Montreal, and Vancouver combined would equal the size of Ottawa. In terms of demographics, we are 80% rural and 20% urban, and our population is just over 1 million people, making us the fourth largest city in Canada. The World Health Organization stated that climate change is the single biggest health threat facing our communities. And we know that climate change affects the social and environmental determinants of health. It is a public health issue. An action on the built environment as a determinant of health that impacts climate vulnerability is needed. So how our cities are built has the potential to promote health in the changing climate and prevent health impacts and inequities due to climate change. This slide shows the climate projections that were developed for our national capital region. And it showed that temperature for the City of Ottawa by 2050 would be 3.2 degrees warmer on average and have 4 times as many days over 30 degrees Celsius. And it'll also see an increased likelihood of extreme events, have 43 fewer days with snow cover. And of course, there are a bunch more indices that were projected, but I'm just going to focus on showing you some of these highlights. The number of heat warnings in Ottawa has been increasing, especially in 2019, 2020, and 2021, where the numbers of extreme heat days doubled over the past average. So this is worrying, and especially so during the pandemic when facilities and public spaces were closed and access was restricted, and there were few places to go to cool off when the weather was hot. There are many hot countries around the world, and Ottawa has always had hot and humid summer weather. But the key is to find out how to influence the built environment and set them up to be able to make people more resilient to the extreme heat of the future. You can see why working on climate change adaptation is important. In order to impact our built environment, we decided to influence an upstream policy, so focusing on high impact work. And this meant that we would work in influencing the official plan, and we refer to that as an OP. So this is critical legislative municipal it is a critical legislative municipal document that functions as the blueprint for how communities grow. So the OP process is done every 10 years, and it's a perfect opportunity to integrate healthy public policy. Here's a nice illustration of the policy hierarchy that explains why we focused on the official plan policies. To the left of the blue circle are policy documents that are under provincial responsibility, and it's using legislation that was set up from the Planning Act. The Planning Act and the provincial policy statement sets the foundation upon which all OPs must adhere to. And the OP is a municipality's primary policy document to guide growth and development over a 25-year horizon. The Planning Act also sets out additional tools that municipalities can use to implement the OP. So these tools are to the right of the blue circle. Embedding a climate change and health lens into the OP is a significant way that then informs the other tools. So 2 public health staff were co-located into the planning department to help write the official plan policies that are related to health and climate change. One was, and still is, a registered professional planner, and the other one was and is the environmental professional, so that would be me, with the expertise in planning, environmental health, and climate change. We were physically there, so we had cubicles beside them. We were able to see them. We built on existing relationships. We created new ones, and that really helped us when we had to go virtual because of COVID. So we influenced the OP creation and helped increase the knowledge of health impacts to city planners involved in the official plan. So this included policies on extreme heat and green buildings. So I added this slide to give you a flavor of the goals of the official plan and how it included climate change, health, and equity. So unfortunately, I don't have time to go into all of this detail, but I wanted you to have it. So I think we'll be sharing the slides afterwards with you, and then you can take some time and take a look at the details here. So here's an example of official plan policies created to mitigate the impacts of heat, protect people, and create safe environments. So these are all based on urban heat maps, and the official plan policies recognize the value of trees to provide shade and cooling and prioritize them. It also encourages shaded spaces and active transportation and decreases the urban heat absorption through incorporating heat mitigation measures. Here's an example. The official plan also addresses energy and climate change. So it created a green building standard called the High Performance Development Standard. And for short, we call it the HPDS. So this HPDS is a collection of voluntary and required metrics that define high performance and new building projects to advance sustainable and resilient design. So the standard is to be applied as part of the development review process. I was an active participant in the interdepartmental committee that developed these standards for new buildings, and it took many months. It involved about 30 people with various areas of expertise, and there were lots of meetings with developers and the public. So I helped provide evidence on issues such as air pollution, soil volume, equitable access, and sustainable roofing. So the standard will be phased in over time to build staff and industry capacity while still accounting for the climate change targets that the City of Ottawa set. The standard would be phased in gradually starting in 2022. So it's already started, and they will be reviewed every 4 years and updated, with the energy metric advancing in each update, as you can see at the top part of the slide. So the HPDS applies to site plan and plan of subdivision. So site plan is a planning tool that a municipality uses to evaluate certain site elements. Think walkways, parking areas, landscaping, or other exterior design on a parcel of land where development is proposed. And the plan of subdivision is what creates new separate parcels of land, and these can be legally used for the sale of the lots for the purposes of development. So for the site plan control, there are 12 metrics required under Tier 1 and 22 metrics under Tier 2. So within Tier 1, for example, you have cool landscaping and paving, EV charging, and bike parking. Within the Tier 2 metrics, for example, there's operable windows, interior room temperature maximums, refuge areas, EV infrastructure, and bike storage. So it's important to note that energy efficiency modeling is only required for buildings over 2,000 square meters, which was in response to industry concerns related to housing affordability and consulting fees. So if I just expand a little bit, things like in the tier 2 metric for the site plan control, the idea was to support operable windows. And the idea behind this was if the windows were able to open, and if you had, for example, a heat event at the same time as you would have a power outage, you could still open the windows and get some air movement through the apartment, for example. So for the plan of subdivision, there were 3 mandatory metrics. So 3 were for tier 1, and then we had 5 voluntary metrics in tier 2. The community energy plan supports embedding long-term energy planning at the outset of the community design. So that encourages an integrated approach to energy planning with multiple stakeholders, including developers and utilities working together. So here are 2 examples of OP policies that are relating to the HPDS. So the official plan encourages innovative design practices and technologies in the site planning and building design, and encourages photovoltaic panels, permitting green roofs and rooftop gardens. So here's a sample of the policies we worked on that were cross-cutting health, climate change, and equity. It's a long list. We did create an infographic that you can see on the right side of the slide, and that has a sample of the actual policies. And I've included a link that I will put in the chat in a couple of seconds. The reference slide at the end of the presentation is at the end of the presentation, and we'll have a lot of links that you can use if you want to dive deeper into some of these policies. There are upcoming changes that will impact the policies that were recently approved. There's a draft provincial policy statement out for review now, and we're expecting some guidance on green building requirements sometime this summer. And that may change what policies will apply in the future. So this is my contact information. If anybody wants to reach out and talk about any of these things, I'd be more than happy to have a meeting with you or a call. You can reach me at birgit.eisenheim@ottawa.ca. Here is another slide with a bunch of links, and I will, as soon as I stop sharing my video, I will be able to drop a bunch of those links into the chat. So let me just stop sharing and I'll get to that. Oh, did I forget to turn on my camera?
Yeah, I can't see you, Birgit.
Well, give me a second. Sorry.
Okay.
How did that happen? Start
Thank
video.
you.
There we go.
Thank you. That was an incredible summary because it's a lot of work. And then I'm going to let you kind of, do you need to concentrate for a second, or can I ask you a quick question?
Oh, go ahead. You can ask that. Go ahead.
This is the broader question. I know that you and Inga, the other public health person who was involved in the planning process, that you've been involved in like planning issues as kind of consulted, as opposed to the collaborative that you've had over the last 3 years. Can you just talk a little bit about the difference in terms of the impact, being kind of immersed in it versus just being consulted about it?
Sure. So we call it the outside lane versus the inside lane. And so on the outside lane, what happens is there's a lot of work that gets done behind the scenes over years. And then that gets circulated to partners. And it's almost like 90% set, the wording, the research that was done. And there's very little flexibility for change, very little time to change. And so that doesn't give you the same opportunity as if you were immersed in the beginning and have those discussions and say, you know what, I'm glad, you talked about whatever it was. Let me go back and, do a literature review, find out what the evidence says. And I come back with that evidence and I say, here's the evidence that I have that will support you in making a decision that is more health related from a public policy perspective. And who can argue with that? And then that sets the stage. And as you're like there are trade-offs that happen, right? So you might think in your mindset, oh, ideally I'd like to have X, but we don't realize there may be some, problems with implementing it. There may be some maintenance issues with it. And so when you have all the different departments talking together at the same time, and then if the health department can be there as well, the outcome is more along a advanced, healthy policy than it would be if you influenced it from what we call an outside lens, right? You get more traction, more confidence in each other, more trust, and then that can build into influencing future downstream policies. Like, for example, Ing and I are working on helping on the zoning bylaw. And so we're there as, I guess, internal consultants in a way, where the staff talk to us and we go and get some research for them, and we work together in advancing those official plan policies that we helped write. I can't hear you, Kim. Sorry.
Sorry. Before I turn to the questions in the Q&A, I guess I also can I just ask you to highlight a few more of the health benefits associated with the high performance development standard? Because I know you were mentioning some things when we did an interview several months ago that were kind of really interesting and kind of innovative, but just to give people a clear sense, a lot of this is kind of high level because of the time, but just to give people a little bit more of a sense of how you can actually benefit, like improve health and perhaps health equity.
Sure. So some of the, tier 1 or tier 2 metrics were things like thinking about stroller parking, thinking about air intake. So you wouldn't want to have the air intake of a building facing the exhaust of another building, for example. And so requiring them when they draw what we call a site plan drawing, if they articulate where the neighboring property's air intake is, then you could, before you build the building and do all the design work to figure out where the air intake is, you could figure out, okay, well, I am beside a highway. I know that it's a high traffic corridor. I know there's air pollution related to that. If I move my air intake from not facing, the highway and putting it behind the building, then I'm improving air quality. There's like the air that's being drawn into the building already. And so little things like that, we were able to work at implementing into these standards. And also, you have to remember that these things some of them are voluntary. These voluntary ones end up becoming mandatory as time goes on.
And then maybe just bigger picture in terms of if you're kind of moving to green buildings that are more energy efficient and perhaps relying more on renewable energy, can you just, and again, maybe it's kind of obvious, but just highlight some of the big advantages from an health and climate perspective.
So the whole idea of buildings becoming more energy efficient over time is that we're reducing the amount of greenhouse gases being emitted into the atmosphere because you burn those fossil fuels. And so if you can get to the point where you're not emitting any of those, that means that the amount of greenhouse gases that are in the atmosphere will stay the way they are. And if we can keep reducing, we can slow down the pace of the energy that's in the atmosphere that's creating the climate havoc that we're seeing, like, crazy, crazy hot weather, crazy, crazy cold weather here, there. So the whole idea is to get down to net zero, and that itself is good for the population as a whole, for the world, but also for people in our city.
Thanks very much, Birgit. And again, before I turn to a few questions that are in the Q&A, and maybe Ilse, can you kind of come online just so I can go back and forth between the two of you? Thanks. Hi. So Ilse, maybe I'd kind of turn it back to you. If you could talk a little bit about, in terms of process, you mentioned that there's kind of this round table that kind of provides advice to you at every step in the way. Can you just talk a little bit about who's at that table and how often they meet, and not in terms of the actual individuals, but like kind of, and maybe how that interacts with your work as a staff person with CVRD?
Yeah, thank you, Kim. I'll do my best. Being on the sort of outside of that now, moving away from that world. Yeah, the Airshed Roundtable was established many years ago now, maybe even 10 years ago. it was established to address air quality related concerns in the valley. We have representation from the school board, the paper pulp mill, as I mentioned, health professionals, government, both municipal, provincial, and regional districts, and coming up with a strategy, an airshed management strategy, basically. And under that strategy, there's that small piece that I was talking about, which is offering rebates. But there's many other aspects of that strategy, which includes addressing backyard burning, looking at vehicle emissions, providing curbside collection of yard waste to reduce backyard burning, and many, many other aspects. But yeah, it's a wonderful network to bounce ideas about, and making these connections, sort of what Bridget is talking about too, like connecting to people who have different kinds of knowledge and seeing things from different lenses. And that's so incredibly valuable.
Thanks very much. So I'm going to turn to the questions in the Q&A. So the first one is from Richard Gould, who I believe is a medical officer of health in York Region. So Richard can correct me if I'm wrong about that. Aren't residents there eligible? So I guess they're being, for you, Ilse, eligible for the Canada Greener Homes Program, rebates up to $5,000. What do you recommend as a backup for the heat pump? So kind of two comments.
Yeah, so residents, they would have to determine themselves if they're eligible for the Greener Homes grant or any other grant. We got many other programs here provincially too. But in theory, as I mentioned, like you could stack these rebates together to maximize the amount of money you get. As I mentioned too, the main challenge is that some of these rebate programs are very time consuming and very difficult to navigate. Even colleagues of my own who have, master degrees are struggling. So that is a barrier. And what I mentioned too, like a good backup for a heat pump, if you're living in a rural area, could be a heat pump. Personally, I have baseboard heaters, but when there are power outages, I have nothing. So that is, and as Bridget mentioned too, like we're seeing more snow as well as heat. So it's an interesting time to think about how you're going to stay both cool and hot or warm during cold times. So yeah.
Thanks, Ilse. Over to you, Birgit. We've got a question from Wanda Martin. Do you think that the high performance, I can't remember, development standard could be applied to First Nations communities?
I don't see why not. I do think that a collaborative approach in creating standards is necessary in order for the standards to be applied. I'm not sure how building codes and the First Nation communities work. I'm not sure about that process, but collaboration is the key to advancing those standards. But also, I think figuring out what is most important for the building types that exist in your community. So for us, we're applying a lot of these standards to buildings that have more than 4 floors, for example. Like we're thinking high rises and things like that. But it doesn't mean you can't apply that for lower rise buildings. I'd love to see it in lower rise buildings as well, but yeah.
I have actually heard that there's a First Nations organization. I think it's a company called, I think it's AKI. They're actually putting heat pumps in First Nation communities, and they're kind of doing it in kind of they're just going in and they take care of all the upfront and applications. They just go in and they kind of do the work as the residents kind of agree to them. So I don't know about the Green Building Standard, but in terms of building retrofit, there seems like there's quite a bit of good work going on in First Nation communities. Back to Ilse, can I just ask you a little bit more about, I think one of the things that we are hearing from people, particularly people who are working on lower incomes, is it's kind of the upfront costs that are really problematic. And then sometimes too that upfront costs as well as the complications. So is there anything more you can offer about what you were doing in CVRD to make the process simpler for people or more affordable for people?
Yeah, I mean, we've been having a lot of conversations with the province on this, recognizing the accessibility issue. You know, one of the argument is like, from a air quality perspective in the valley, if anyone in the neighborhood is able to upgrade to a healthier home heating system, they will benefit everyone in their neighborhood. For example, we have a bunch of houses around a track and field place where a lot of children run and play. And those houses use wood stoves. So if anyone in that neighborhood is able to upgrade, that will help everyone there. But yeah, as mentioned, that is a barrier that we continue to grapple with. And we're talking about, you know, similar if you buy a vehicle, and I know that some of the incentive programs offer upfront like loans, low or no interest loans. So making something like that available, but it becomes a question of who administers it, who runs it, where's the funding coming from. So yeah, it is a bit of a puzzle, but we're hoping that the province here will assist with coming up with some solutions.
Almost as if we could have it put onto our utility bill. So I think that's what they may have been doing with ACCI, where they would do the work and then people paid for their heat pumps over time on their utility bill. And because their utility bill was going down because of energy efficiency improvements, their bill was actually coming down. So something like that, which I know for you folks, that might be beyond your jurisdiction, but certainly for a federal provincial program, that would be really wonderful. We've got a question, a comment here from Penelope Kuhn. In Nova Scotia, Efficiency Nova Scotia coordinates the government rebates for heat pumps, and it's a very streamlined process. And she has provided a link for people who would like to go in there and take a look at that. And I have heard that Nova Scotia does some really great work around energy efficiency. And then a comment from Jean-Patrick Toussaint. Hello, thank you for the excellent presentations. Question for Birgit. Apologies if I missed it, but could you share a bit more about how the equity lens has been incorporated into the high performance development standard?
Sure. So for the equity lens, so the goal for the official plan was to make it more age friendly in the design, and looking at making sure that the needs of children and older adults are considered, so that when we design those communities, everybody can live there and thrive for all stages of life. And so there's a lot of consideration that was done in terms of the needs for women and other equity-seeking groups in the idea of placemaking, so culture, and also in terms of urban design. In terms of culture, if certain cultural aspects were like a feature, for example, I think there were certain points that were attributed to that. There's also the idea of different sizes of apartments, for example, for bigger families. Right now, most of our apartments are 1 bedroom or sometimes 2 bedroom. Very rarely would you see 3 or 4 bedrooms. And so now that we know that people that are coming into Ottawa have bigger families, we're expecting another 400,000 immigrants into Ottawa in the next 25 years. And so considering that they're coming with bigger families, the idea is that if a builder were to design an apartment building with more of those units, there would be points attributed for that as well.
Thanks very much, Birgit. That's great. I'm just going to check the time here. So we still have a few more minutes. Just a comment here from Richard Gould, who did correct me to say he's an associate medical officer of health, that he used to live in Nova Scotia and he had a heat pump with a propane burner in the furnace that was used as a backup if it was too cold or power was out. So just a comment there. And then I'll just say that I've been doing a little research for this project and looking at green buildings and kind of building retrofits, energy efficiency retrofits, and looking at various intervention studies that have kind of found that often when you improve the energy efficiency or you develop a building for green building centers, you just create a healthier indoor environment, and that you actually do see a reduction in respiratory infections and many other health complaints, and that's particularly true for lower income populations. So I think even sometimes with some of these things, there can be benefits for everybody. So provided that those groups are prioritized. So I think what we'd want to see is if the green building standards actually being applied to low-income housing or to affordable housing, that should provide some benefits for everybody. So I think that's one of the tricks. Are there any other comments or, pardon me, Ian, are there any questions in the chat that we should be aware of?
No, I'm not seeing any there.
Okay, and so before we go, because I don't see any other questions right now, but maybe I could just ask if Birgit or Ilse, would you like to any kind of last minute things you feel like would be really helpful for people to hear about?
There was like another official plan policy that I was able to put forward, and it was dealing with children's play structures in relation to high traffic corridors. And the idea was that they were either going to be set back from a high traffic corridor, and if they couldn't reach that back, then they would have to provide some type of vegetative barrier that was either a combination of shrubs and trees in order to create kind of like a pollution absorbing wall. So you don't want to see, the outdoor daycare areas abutting like a 6-lane street, for example, and having children play at like where their heads are at the same level as the exhaust. And so there's a lot of research out there that shows that these hedges can absorb as much as 50% of the pollution. And if you think of the winter months, the coniferous trees would be better because they have the leaves and can also capture some of the pollution. And then when it rains, it'll just drip down into the soil. But those were some of that was like one of the great policies that I was able to advance.
Thank you for that. And then I've got another question here from Maria Ekonomova, a question for Lise. Ilse, sorry, have you conducted, and I don't know that you would have done this, Ilse, but maybe somebody you were working with, have you conducted any health impact assessments to estimate the health benefits of switching from wood burning stoves to heat pumps?
Yeah, thank you for that question, Kim. You're right, I have not done that, but I believe that research has been done. I recall someone in the Airshed Roundtable presenting on that. Yeah, I know that generally there's a lot of, we know that having a wood stove in a house impacts both outdoor and indoor air quality. So that's a known fact. And then you can compare that with using a heat pump, which we also touched on, has the ability to increase indoor air quality. So I can't speak to the specifics, but I know that that research exists.
Thanks, Ilse. And then there's 2 comments here from Richard Vandergut. The people coming to do energy audits are not well trained is one of the things he's pointing out here. And he indicates that they live in Ottawa and they want to go green, and they had various estimates for solar and heat pumps from various providers. And they all told us it would not be worth our while, which is kind of concerning. And I have to say, I went through kind of a similar thing here. I really wanted to put in a heat pump, and it turns out that my furnace is too new, and so the rebates wouldn't apply. And it does sound like there's a lot of kinks to be worked out in the system to actually make it usable by people. And so I think those are problems that kind of implementation problems that have to be worked out. And then Richard Gould again is saying that in Ottawa, staff are embedded in planning. What is the relationship with transportation planning and I guess with the department? So I guess, is it go beyond planning? Is that kind of extended your relationships to other departments?
So we do have a relationship with transportation planning. We had someone from transportation embedded into the official planning team. And there's a good relationship there as the transportation master plan is being rolled out. And so we had an opportunity there to work closely with the people leading their master plan as well. And so we were able to integrate some thoughts into their work as well. So yes, we do have great relationships, I would say, across many departments in the city of Ottawa. So I'm really lucky to be working with such great colleagues that are open to new ideas. And I also understand the trade-offs. So I think you need to work together, right? You can't, you have to understand that there's a give and a take as you go forward.
So Birgit's co-worker from public health Inga was involved in the official plan from the perspective of trying to create the 15-minute neighborhoods. And so there was a lot of work around what makes a walkable community, what makes a complete community. That was kind of a focus of another webinar and another issue that's really be interesting for you to look at, Richard. And then let's see, Richard Vandergat, and I'm sorry, I'm saying your last name improperly, I'm sure. I'm on the community benefits agreement for Manor Park in Ottawa and propose that we move to developing a community microgrid, and we're all in agreement. This would provide stability of the energy supply and at a lower cost. So a comment there, and I don't know if you want to respond to that, Birgit. I'm not sure that you needed to. I think he's kind of sharing that, but is there anything you'd like to respond on that?
Well, I think having backup power is very important, or being less dependent on the grid as it is. And I think there's a lot of work being done by Hydro Ottawa on figuring out that side of the world. Like, as we're having more electric vehicles, how can we use, say, the electric vehicles to store energy to power our house should we have power outages? I think there's a lot of work being done in that area. I'm not saying Hydro Ottawa is doing that work, but I think a lot of the energy companies are looking at that as a way of making the communities more resilient.
Thank you, Birgit. Thank you very much, both Ilse and Birgit, for excellent presentations and for all the wonderful work you've been doing over the last number of years. And I think we're finished from my end. And thank you to all of you who have joined us today and for your questions. And Ian, I'll pass it back to you.
Thank you all for being with us today. As Kim has mentioned, the recording of today's webinar, along with the presentations, will be posted to CPHA's YouTube channel. And everyone who registered for today's webinar will receive a notification when those become available, probably early next week, depending on my schedule. So thank you all very much for joining us. Thank you, Kim, Ilse, and Brigitte. It's been a great session, and look forward to hearing about this work as it moves forward. Thank you all very much, and have a great day.